Hi, I'm Dr. Klein, and I'd like to walk you through what to expect if you're considering a Davinci hysterectomy. This procedure is a minimally invasive surgery to remove the uterus, most often done for conditions like abnormal uterine bleeding, fibroids, pelvic pain, or other non-cancerous issues. It's performed using the Davinci robotic system, which gives your surgeon more precision and control through a few small incisions. Let's go over the benefits, risks, alternatives, and what to expect after surgery. First, the benefits. Because it's minimally invasive, recovery is typically faster and easier than traditional open surgery. Most people go home the same day or after one night in the hospital. You'll have less pain, smaller scars, and a lower risk of infection. Most patients are back to light activity within 2 to 4 weeks, and the robotic assistance allows for more precise surgery, which may help reduce the risk of injury to nearby structures like the bladder or bowel. Of course, no surgery is risk-free. With a Da Vinci hysterectomy, the most common risks include bleeding, infection, or injury to nearby organs. There's also a small risk of developing blood clots in the legs or lungs. And, like with any procedure under general anesthesia, there's a chance of breathing problems or other anesthesia-related complications. Before you decide on surgery, it's also good to know the alternatives. Depending on your specific condition, other treatments might include medications like birth control pills or hormonal IUDs to manage bleeding, endometrial ablation, which destroys the lining of the uterus, myomectomy, which removes fibroids while leaving the uterus intact, or uterine artery embolization, which shrinks fibroids by cutting off their blood supply. These options won't work for everyone, and they may not be right if your symptoms are severe or if you're done having children, but it's worth a conversation. Now let's talk about the ovaries. During a hysterectomy, we sometimes also discuss whether to remove or keep the ovaries. Keeping your ovaries means your body continues to produce natural hormones, which helps protect your bones, heart, and mood, especially if you're not yet in menopause. However, if you're at high risk for ovarian cancer, like if you carry a BRCA gene mutation or have a strong family history, removing the ovaries might be the safer option. This decision is personal and based on your age, your risk factors, and your overall health. What should you expect after surgery? Some cramping and light vaginal bleeding are normal. You'll also feel some soreness at the incision sites. Most people are up and walking the day of surgery. You'll likely feel better within a week or two, and most patients are fully recovered in 4 to 6 weeks. Your doctor will give you detailed instructions about activity limits, lifting, wound care, and when to follow up. To sum it up, a Da Vinci hysterectomy offers a safe and effective way to treat certain uterine conditions with less pain and quicker recovery. But like any medical decision, it's important to understand the risks, benefits, and all your options. Take time to talk it over with your doctor, ask questions, and make sure you feel informed and comfortable before moving forward. Thanks for watching.